guys for joining us. So this is just a webinar with NAMI Cook County North Suburban and Bonnie Lane. My name's Courtney. I'm the Adult and Family Programs Manager with NAMI Cook County North Suburban. NAMI is one of the nation's largest grassroots mental health organization. We offer no-cost support, education programs, and presentations. And again, our programs are free. So we're so glad you guys can join us here tonight. This year and each month, we've had mental health professionals join us to dig deep into a variety of topics to further educate us. So during this workshop, Bonnie will talk to us about finding resources for your loved one, treatment, benefits, and housing through all levels of care. Like Bonnie mentioned, we'll have a Q&A at the end of her presentation, but you can also raise your hand or type in questions in the chat box. But thank you for being here, and Bonnie, go ahead.
Hi, welcome. Thank you for taking time out of this evening. Courtney didn't say it, but I have been on the NAMI CCNS board at least 3 separate occasions for a couple of years each time. And I currently still serve on the NAMI Housing Task Force for North and Northwest Suburban Cook County. I'm also on the NAMI Legislative Commission for the state of Illinois, where we try to get better laws enacted for people that struggle with mental health issues and their families. So today I'm going to talk about levels of care and how to find resources and housing, and what benefits are available to pay for them, or if commercial insurance is the best option. Mental illness runs a gamut from anxiety and depression, ADHD, all the way through severe psychotic illnesses, bipolar, which is a mood disorder, schizophrenia, which is a thought disorder, schizoaffective, which is a combination of bipolar and schizophrenia. And it starts as young as the youngest case was a 4-year-old with schizophrenia, a 7-year-old diagnosed with bipolar. These are very unusual cases. And people typically become symptomatic between the ages of 18 and 26. What happens when our loved ones start to develop a mental health condition is we may notice it long before they do. Sometimes as we notice it, we can have a conversation with them about it. And sometimes we see it exacerbating and they're in denial, which is called anosognosia. Anosognosia is a lack of insight into one's own mental health condition. So how do we get them help? If they are willing, we can take them to a psychiatrist to have medication prescribed and managed. We can take them to a therapist to work on talk therapy, and we can put them into a variety of programs. If they have a serious episode, it may need hospitalization. And if they are unwilling to go to a hospital, there are ways to get our loved ones involuntarily hospitalized or into detox through a legal matter called a writ or a petition. I'm just going to talk on this very minimally, because I'm going to talk more about resources that are post-hospitalization. But a writ or a petition involves going to your county courthouse and filing paperwork that determines that your loved one is a danger to themselves or others, and a trained police officer will come to your home and take them to the hospital for a 3-day involuntary assessment. A psychiatrist in the hospital can then determine whether or not your loved one needs to be hospitalized longer. If they need stabilization, that will be the case. And sometimes after stabilization, they can come right back home and continue their lives, school, work, however they're living. But sometimes after hospitalization coming home isn't an option. And then we have to look at treatment options. So the treatment options that are available are residential, intensive outpatient called IOP, and partial hospitalization, which is called PHP. It's actually PHP and then IOP. Residential in the state of Illinois does not exist on Medicaid. So primary mental health residential treatment requires commercial insurance done at that level. If you are able to do an PHP or an IOP, there are Medicaid-based programs. Most of them are hospital-based, like Chicago Behavioral Health, North Shore Endeavor, Lake Behavioral Health, Streamwood, Ascension, Alexian. So depending on where you live and what your Medicaid is, there are options for day treatment. PHP is usually 5 days a week for 5 hours or 6 hours a day. And then you step down to IOP, where it could be 5 days a week for 3 hours a day, or 4 days a week for 5 or 4 days a week. And it steps down until you're ready to do outpatient care. If your loved one is able to get into meaningful recovery with that level of treatment, they're medication compliant, and they're ready to live independently, we then have housing. So let's talk about what med compliance means. Med compliance means they take the medications prescribed as directed. It means you don't have to prompt them, threaten them. You are able to just say, you know, let's set up your meds once a week, and they take them on their own. Minimal prompting is still okay, as long as they don't go off it. The other consideration is if they are concurrently using recreational substances such as marijuana or alcohol or something stronger, then residential is probably the level of care that would be required for dual diagnosis treatment. Dual diagnosis treatment means a serious mental illness with addiction. There are other forms of dual diagnoses that don't involve addiction, but that it's rare. But you could have an eating disorder and OCD, but they're so severe that you're not able to live your life to the most comfortable way, a way that you can function. But for our purposes, dual diagnosis is serious mental illness with addiction. So there are some places in Illinois that do accept commercial insurance for dual diagnosis. If it is your child, your sibling, your parent, and they don't have commercial insurance, you can usually purchase insurance from an insurance agent. I'm not saying the Affordable Care Act. It would have to be purchasing a private policy of mental health care coverage, and you'd want to make sure that your policy covers residential level of care for mental illness. You can look at the back of your policy for a phone number and call your insurance agent to make sure that you have the right level of care for whatever you need. And right now is the best time to do that because it is open enrollment. We are not allowed to change our policy anytime during the year, only with life events or open enrollment. So if you don't have a life event like marriage or divorce, then we need to rely upon the open enrollment time of the year. And it's right now till, I believe, the end of December, something like that. I know it started the beginning of November. It may be mid-December. It's been shortened considerably by the federal office that oversees insurance. So make sure that you check your policy and know what your policy will cover, because if you want to change it, upgrade it, or update it, this is the time to do it. So let's say you need residential level of care and you do have commercial insurance, then your choices are staying in state or going to a facility out of state that accepts your insurance policy, or privately paying for either one. If you're on Medicaid, but that person has financial resources, you can always privately pay for the residential level of care. And if you have an advocate like me, you can usually have a negotiated rate. I should tell you that I didn't really introduce myself well, but I'm a therapeutic consultant. I'm a psychologist. I work with individuals and families that are responsible for a loved one, 13 to 60, that struggles with a serious mental illness or addiction. And I provide all wraparound services, including treatment, housing, legal issues, linkage to attorneys for guardianship, special needs trusts, and criminal matters. So I work to bubble wrap the family in whatever resources they need. So we are now stepping out of the residential level of care. And we're saying, okay, they've successfully completed the residential level of care. And now what happens? Most likely they will step down to PHP, partial hospitalization, which is shorter. You don't live there. Some PHPs do have housing. Your insurance will pay for the clinical part. You will be responsible for the housing part. Sometimes you can find a PHP in your community and your loved one can still live at home. And that's a really good solution for some people. If your loved one does not have a substance use problem, that's really good. If they do, you may want to look into either a sober living while they're in the PHP, which is housing without treatment. It's a place to live where they will have random drug tests and they will not be able to use because it will eliminate their ability to stay living there. We have sober livings all over the city and the suburbs at different price points and offering differing amounts of services, and depending on what you need and what you can afford and how it's accessible to your PHP or IOP, that will make a determination on where you choose. I'm going to step down now. You're in IOP. Same housing situation. You can live in a sober living, or you can live at home, or you can live with family. And you must attend IOP anywhere from 5 hours at 5 days at 3 hours a day, all the way down to 3 days a week at 3 hours a day. Sometimes you can go down to 2. And once you complete that, you can either be done with treatment if you are successfully in recovery, or you can continue with seeing the people there and extend your treatment, or you can transition to outpatient care. And outpatient care means seeing a psychiatrist and a therapist, and perhaps linking yourself to a mental health agency like Thresholds or Trilogy that do home visits. Thresholds, Trilogy, Kenneth Young, Alexian, a lot of them have CST and ACT, which are home visit opportunities where they come and visit your loved one or yourself at your house as an outside case manager. They do accept Medicaid. I will tell you the wait is kind of long, but they do accept Medicaid. They can even do it when your loved one is still living at home with you, just to help them do everything they need. Now, let's say your loved one was on commercial insurance and you know that they can't get a marketable job that'll provide benefits, a full-time marketable job. How do we get Medicaid? Medicaid is a state program, which means you go online to medicaid.gov and you apply for Medicaid. You will probably be interviewed, And as long as you don't have a job that says that you are able to get commercial insurance or over $17,200 in the bank account, you are eligible for Medicaid. Um, I wish I could say things move quickly now. Medicaid used to be pretty fast, but there's a lot of funding issues, and I don't know how fast the state government is working, as well as how fast the federal government is working. If you are eligible for Medicaid and you need added financial assistance, SSI, Social Security Insurance, and SSDI, Social Security Disability Insurance, are also available by application. Those are federal programs, and right now they're not working, but hopefully they will be soon. And you can apply for that then. During good times, that took about a year. Jeffrey Rabin, who is the executive director of NAMI CCNS, has a law firm that does Social Security insurance and Social Security disability insurance. If you feel you or your loved one is entitled to it, there are people there that can answer your questions, or you can ask me afterward. I will put all of my contact information in the chat, and Courtney is going to put like a slide up at the end so you can write down all my contact information or take a screenshot of it. So now we've gone through the levels of care and where do you live? There is a variety of ways of living, okay? The first one, and I would say the lowest level of care would be subsidized housing. Most of them do include the need for having Social Security because that's how they're paid. They will allow you to be able to live in an apartment in many communities around the state in either a freestanding apartment, which is just scattered site, you pick where you want to live, or in buildings that are built and that are all over from the city all the way to Elgin, all the way to the western suburbs and Deerfield. Northbrook just broke ground for one. And they are disability housing, they're mixed use, but you can get a voucher and you go on housingtaskforce.org and www, the housing, I think it's just housingtaskforce.org. And you can find out what their hours are and look at all the different sites that have apartments. The apartments are lovely. They're studio and one bedroom. And if you're married, you can have two bedrooms. Most buildings don't actually offer the two bedrooms, but a few do if you're married and both people are disabled. So, so if you are interested in that level of independent housing, it means completely independent. You grocery shop, you cook, you clean, you go to a volunteer or a regular job, you take classes at a school, you're able to entertain yourself, then that might be the right level for you. But let's say you need a little more support. You can ask for linkage. You can live in one of these apartments and again, get a CST or ACT team to come and visit you once a week to make sure that you have everything you need. Sometimes they'll take you to doctor's appointments or they'll take you to the grocery store. They cost 1/3 of your Social Security, so they're very affordable. Most of the buildings are relatively new, so they're lovely with new appliances, a washer dryer in unit or in the building. So you'll really be able to take advantage of living your life. They are all in convenient locations. The buildings, not the apartments, but the buildings are all in locations convenient to resources that you may need, which means they're near a grocery store, a bus stop, a medical facility, either a hospital or an urgent care so that you can get treatment that you need. Look at the address and make sure that before you write down your preference for a certain building, that what you need is accessible to this building. Really important. But let's say you need a higher level of care and independent living isn't going to work. If you have Medicaid, well, let's start out with if you are struggling with substance use, we have recovery houses, sober houses, and Oxford houses. They don't take Medicaid. They're funded by the Department of Human Services, and you are required to work there. And you work there for a certain length of time, and you live there for a certain length of time. It's usually 3 months to a year. During that time, you get a job, you're supported, you have a therapist, they manage your substance use. You can have a co-occurring mental health disorder, but you cannot be severely mentally ill, which means you cannot be currently manic or psychotic. And you pay rent. You get a job and you pay them $500 to $580 a month. There are recovery homes, sober livings, and Oxford houses also around the country. They're an excellent option for somebody trying to get back on their feet, especially if addiction is a primary concern. If mental health is your primary concern, then we probably need to look at something else. But if you have a comorbid, which means co-occurring mental health issue with substance use, a recovery house, a sober living, or an Oxford house are really good places to go. But if mental health is your primary concern and you are not currently using substances, then we have SMRFs. And SMRFs are specialized mental health recovery facilities. A specialized mental health recovery facility is no other way to phrase it. They're converted nursing homes, and they have a variety of levels of care. Some of them are amazing. The quality of care is incredible. They have in-house therapists, in-house psychiatrists. Yes,
Sorry, didn't mean to
Courtney?
interrupt you there, Bonnie.
It's
We got a quick question through the Q&A that was just about that.
okay. What
About
is
the
it?
housing. Um, Someone asked if someone lives with autism with a mental illness, would they qualify?
It depends on if you're autism 1 or autism level 2. Autism level 1 would qualify as long as they are independently living and don't need a lot of supports in reading social cues or their ADLs, their activities of daily living. If they're high functioning autistic and their primary diagnosis is mental health, not neurodivergence, not autism, then it's fine. So let me explain that. We have 2 different communities at play everywhere, but in Illinois, we'll talk about it. And we have the intellectual and developmental disability team, and then we have the mental health team, and they have different pockets of money. So we have to look at what your primary diagnosis is. If your primary diagnosis is mental illness, then you can go to a mental health provider. If your primary diagnosis is autism, you would use the Autism World, which would be Communities Alternative Unlimited. That's you can just write that down, Communities Alternatives Unlimited, and you can get put on a PUNS list. And I don't even know what PUNS stands for, but most people do that when they're about 18 in school. Their family knows that they're going to need it because it could take years to get into one of these supported communities, CILAs, or apartments that are supported. If you don't, but it becomes an emergency to get them housing, you can still go through Communities Alternative Unlimited and tell them that you need for emergency use. That's what they call it. And they can push you up the list if your loved one is autistic or neurodivergent or developmentally or intellectually disabled and has no place to live. They would be homeless if we don't find them a place because you don't want them to live with you, or they for some reason cannot live with you. There is no family to live with, and they need the resources of the state. You can push it up, but it's always advisable to get people on the PUNS list when they're 18, so that when they're 21 or 22 and they graduate from school and no longer have academic resources, then they'll automatically get housing resources this way. Did I answer the question?
I
Did
think
the
so.
person respond?
Yeah. No,
Well,
thank you.
whoever you are, if I answered your question, great. If I didn't, feel free to ask me a follow-up. So we're back at Smurfs. So Smurfs are converted nursing homes. The level of care can be amazing. The level of care can be pretty awful. You need somebody that knows how to differentiate the two usually. Um, I know how to differentiate the two. And I will tell you that being on this webinar means you get a free consultation with me. I should say everybody gets a free consultation with me anyway, but now you know about it. So again, feel free to reach out to me with a text, a call, or an email afterward, and I'm happy to answer your questions. I see. Yeah. I wasn't looking at that. I didn't see that there was a special Q&A box. I always look at chat. Okay. So you're looking at living in a Smurf, but you don't want to live there forever. We do have permanent supported housing in Illinois. So the permanent supported housing with disability being on either SSI or SSDI, you can get it on your own. Or let's say you go and you live in a Smurf just after hospitalization or after a psychotic episode or after a manic or while your medications are being stabilized and you want more support. The Smurf will offer you that. They will have somebody that gives you your meds as prescribed, a bed, usually in a shared room. The good ones, it's 2 to a room, some of them 3 or 4. But you'll get a bed, you'll get 3 meals a day, you'll get a case manager. Somebody asked a question, and I'll get to it in a minute because I can't read and talk. You're then entitled to permanent supported housing if you've ever lived in a Smurf. Now, I think that's a great option. The reason it's so good is because after living in a Smurf, there was a lawsuit in the late 70s when we deinstitutionalized the state of Illinois. People that were hospitalized, post-hospitalization, were put in typical nursing homes, skilled nursing homes, otherwise known as SNFs. SMRF, Specialized Mental Health Recovery Facility, SNF, Skilled Nursing Facility. So people were put in them, and there were 2 lawsuits, the Williams family and the Colbert family. And they sued because their loved ones were placed in a skilled nursing home with no mental health, no psychiatric care. And they won. And that's how Smurfs were born. And because of that, anyone that's living in a Smurf from now until forever is entitled to permanent supported housing in the community of their choice for the rest of their lives. That means they can pick an apartment near family, near friends, near the city. Now, it's got to be in the state of Illinois, of course. And they are linked to a mental health agency who will help them get that. They will move into this apartment of their choice, and they can move 3 times during their lives. It doesn't count. Now, if the apartment building that they choose decides they no longer want to have Section 8 HUD housing, okay, they've changed their mind and you have to move, that doesn't count as one against you. You have 3 choices to move. So let's say you choose to live in Highland Park because that's where your family lives, and then your family all moves to the city and you're lonely, you can move to the city. So you can do that 3 times. And you are also guaranteed link services from the agency that has coordinated your move. There is one more option that you will be given if you live in a Smurf. I hate to knock the state of Illinois, but here I go. There's something called Front Door. Front Door will come a knocking when you're in the hospital, when you're in the Smurf. trying to get people to agree to get out and get a place to live. And you can do it right now, even if you're not stable. We're ready to move you if you want it. And they put you in a flea bag motel on the south side of the city. Or it's always bad. It's always with no services. It's find your own services, find your own linkage, find your own psychiatrist, get your own groceries. No one's going to help you budget. No one's going to make sure that you manage your meds. It's kind of awful. If you are, so I would say, and I say this to everyone that I know that's in a psych hospital, when front door comes a knocking, don't answer. Really, really important to tell your family members. Front door sounds really attractive until you realize that you have just given up your nice, safe Smurf life for living without any supports at all, usually in a dangerous part of the city. So it's unfortunate. They find the cheapest places for you to live without resources. Whereas if you wait for moving on, which is the program out of a Smurf, you get an apartment in a great neighborhood surrounded by services. I think that's a no-brainer. And I hope that you all advise your loved ones to do so. So Smurfs. So we have permanent supported housing, we have Smurfs, and we have supported housing. Keep in mind, when I say supported housing, the first kind, it's only subsidized. There are no inherent links to services. You have to find the links when you move into one of the housing task force building. If you have permanent supported housing post a Smurf, it comes with services. So if Smurf is an option, and your loved one is not actively using drugs, not completely unstable, not aggressive. Smurfs can be pretty selective, especially the good ones. They don't want people that are violent or aggressive. So we make sure that before we apply for Smurf acceptance, that people are stabilized on their medication. Smurfs are open door. You can leave at 8 in the morning. As long as you come back by 9 o'clock at night, all is good. If you want overnights, you're entitled to 20 a year, which is great because it used to be 10 and now it's 20. So you can go home for Christmas, Hanukkah, Easter, Rosh Hashanah, whatever you want to go home for. You can go on vacation with your family for 3 days, 4 days, as long as you stick within the 20 days. And that's only because Medicaid won't pay beyond that. So they will not get their bed paid for. Let's say you don't have Medicaid, but you have tons of money.
Mhm.
Can happen. Your family can have a lot of money, but they just don't have the skills to keep you safe.
Mhm.
You can private pay to live in a Smurf, and you still get all the benefits of living in a Smurf and moving on. Let's say you personally have too much money, but you go, gee, this sounds great. You can work on getting a special needs trust account, which means moving your assets to a trust with somebody else as a trustee. Usually families do this on behalf of their loved ones with their loved ones' support if they're able to do that. And once the money is moved, you can get on Medicaid and then you can save your assets. So there are different ways to get to become Medicaid eligible. Not everyone is, but if somebody has a significant disability, there are ways that you can creatively get to be Medicaid eligible. Social Security is a little harder. You have to prove that you are not able to hold a job with benefits. You can't hold a full-time job. So as long as you can work a little bit, but you can't work a lot, you can get Social Security. You will also need to show psychiatrist records, historical hospitalizations, reasons why you can't work a full-time job. Most people, I will tell you, in Illinois do get denied the first time they apply for SSI. I will tell you that my son applied while living in a Smurf, post 10 hospitalizations, and got denied. A year later, thank you, Jeffrey Rabin and his team, we went to court and we appealed it and he was accepted. But So even people that you think, well, there's no brainer, they're going to definitely get approved, plan on being denied once, maybe twice. But with proper documentation and the best lawyer, you will be able to get it, hopefully. Courtney, does anybody have any questions? I'm sitting here looking at squares. I don't know if anybody's even there. Maybe everybody went to get a snack. See,
I
question
can,
of
there's
the-
one, the one in the chat. Do you want me to read it out loud?
If you don't mind.
Yeah. Someone said, my son is 34 in a psych hospital for the last 5 months by court order, but soon to be released. He is in Nevada. If we have to provide private funds for a supervised group home, would our help with housing make him ineligible for Medicaid?
That's a really good question. If the assets are in his name, there's a problem. If the assets in your name, there's no problem. We only look at the assets that are owned by the individual, the identified person. So you can help them with housing. There's no reason why you can't. You can even help them with housing when they're on SSI. They just have to, SSI and Medicaid, they have to show you that from their SSI, they are paying you rent, or it'll be taken out of their check. I have sneaky ways of doing that, but I'm not going to say it on Zoom because somebody will watch this. But there are workarounds for everything. But also, if you want to get Medicaid in a state, you need to have residency in that state for a minimum of 3 months, no matter what state in the union you're in. So you can't go, oh, I live in Indiana and I want to go to Wisconsin, so I'll just go and get on Medicaid, because Medicaid in Wisconsin covers some significant good mental health facilities. Actually, residential mental health facilities are covered in Wisconsin for Wisconsin Medicaid only. So you think, I'll just cross the border and do it. They'll make you spend 3 months in residency, which means a mailing address in Wisconsin to get Wisconsin Medicaid to be able to do it. Conversely, or the same way, if you want to take advantage of our SMRF system, which is unique to Illinois, you have to live in Illinois for 3 months. Minnesota has a great village, a community. Yeah, I think it's 3 months in every state. Yes, that's what it normally is 3 months in every state to have residency. Residency is the key. In order to use our assets, you need to be a resident here. So Minnesota has a whole community with work and activities and a community hall. And I would love all my clients and family to be able to live there. But we're Illinois residents, so there's a 4-year wait to get in. And I can't even get on a waiting list because nobody I know is a Minnesota resident. So there's different ways. Actually, the state of Minnesota has residential and PHP and IOP care on Medicaid for lots and lots of levels of care. It's a great state if you're mentally ill. Illinois has fewer resources for residential. Do you have a new question?
I do. Someone asked, my son has SSDI. Does he need to get a case manager at a behavioral health facility in order to get on a list for permanent supportive housing?
Absolutely not. If you get a case manager at a facility or you hire a private case manager, all they will do is guide you through it. A case manager at a mental health facility won't charge you. A private case manager will. I'll answer that question. I'm just going to get rid of this for a minute. You can go on the housing task force. Let me just wait 1 second. I have my new, I don't know if you can, oh, nobody can see it. Well, if you can see this, I don't know if you can. The new housing task force brochure just came out. Yay, it's beautiful. and it talks about permanent supportive housing combines non-time limited affordable housing and support services for people with disabilities, some of whom are experiencing homelessness. To get on the list, all you have to do is contact info at, if you want to put this in the chat, Courtney, because I can't read and type, info at housingtaskforce.org. Info at housingtaskforce.org, or call them at 847-558-9917. That's right. Now, I will tell you that volunteers, the Housing Task Force phone number is a mobile phone that's passed around. Just so you don't think you're calling an office, you're calling somebody who got the phone that month. So if you call the number, leave a message, odds are nobody's going to pick up, but they will call you back because we are all passionate volunteers. So somebody will call you back and walk you through the website, but you can also just go on housingtaskforce.org, hard to say, housingtaskforce.org, and you can sign up right there and then. If you already have SSI, you're entitled to it. Hi, Barbara. Barbara, you have to unmute yourself.
Yeah. Hi,
Hi,
Bonnie.
Barbara.
Hi.
Hi, Barbara.
I didn't mean to. I was just playing around, checking on the chat and stuff. Thank you. I'm going to unmute. Thank
Well,
you.
you can ask a question right now if you want.
You have a
I'm
question, Rob?
open to that.
Okay, thanks. I'll mute myself.
Okay. So did Lourdes have a question that she wanted to ask? Can you read it to me?
Yeah. So the individual has to work in order to receive Social Security question?
No. Social Security, SSDI, disability insurance, requires that you have worked 10 quarters of full-time work. That's for SSDI. SSI, you do not have to have worked at all. They give you different amounts of money depending on how much you've worked, but you're entitled to the housing even if you're at the lowest SSI rate, 780, I think it just went up to, maybe it's 820. It's low. It'll still just be 1/3 of your income, regardless of what your income is through the governmental program. So you don't have to have worked. If you did work, then apply for SSDI if the person has worked 10 quarters. So that's, how many years is that? 10 quarters for 2.5 years full time. If you've worked 2.5 years full time, you need to be able to show documentation, which means not only did you work it, but you paid taxes and worked full time for those 10 quarters. So it's not like I babysat. I was a caregiver, I was a nanny, and I don't have any records of it, but I worked 10 quarters. Yeah, that doesn't count. That means you worked where you paid taxes, a full-time job. There is another way of getting SSDI though. If you are the child of somebody on Social Security or somebody deceased, you can apply for Social Security disability in their name. If you have already been approved for SSI, or you are in the application process and you are going to be approved, you apply for SSDI if you have a direct parent that is either deceased or accepting Social Security. You can get SSDI, and the bonus is it comes with Medicare, not just Medicaid. And Medicare means you will get accepted to every doctor, not just the ones that take Medicaid, which is super limited. Also, when choosing a Medicaid plan, it's really important to call your local hospital and find out which Medicaid they accept. when you go online to apply for Medicaid, you can be given straight state Medicaid. Yell, no, we don't want straight state Medicaid. Unmanaged Medicaid. I'm not talking about Medicare Advantage. I'm talking about unmanaged Medicaid, just Illinois Medicaid. Most hospitals will not accept. If you go on and you find Blue Cross Blue Shield Medicaid, Meridian Medicaid, United Healthcare Medicaid, Illini Care Medicaid, County Care Medicaid, those are looked on better because they have somebody managing them. It's not straight Medicaid. And so they pay poorly, but better than plain state Medicaid. So check with your hospital. If you're going to need hospitalization, if you're going to need to see a doctor, find out what they accept before you choose your Medicaid. And let's say you've already chosen your Medicaid. It's okay. Find out what they do. And right now it's open enrollment. Go online and change your Medicaid or talk to your representative, your Medicaid representative, and say, I have Illini Care, but my hospital wants Meridian. And so they will change that for you. Also, make sure if you want somebody else to access anything about your Medicaid while you're not able to, you need to make sure that you give an ROI, which is a release of information, and a permission to advocate for me. You tell that to Medicaid, and they will send out a form. It's very official. They will mail you, snail mail you a form where you fill out who can make decisions on your behalf or speak for you. I've had to do that with my son many times because they lose it a lot. And he'll write down my name and then we'll mail it back. And then you would think that when we call, they would say, oh yeah, you can speak for him. It doesn't work. But I usually have him near me so I can say I can talk. And he's like, she can talk. And they usually believe that because it would be hard for me to have hand puppets doing that. I see another question.
Yes, someone asked, do you know about other good states for mental illness? Specifically, do you know about Utah or Colorado?
Okay, that's a really broad question. Okay, good states. I will tell you that the Northeast of the country is bad because individual rights rule, and you can, as they like to tell me, as I fight with them, it's not illegal to be psychotic. So you can walk down the street completely psychotic, injuring yourself, and they'll go, well, that's your freedom. You can stand in the middle of Seattle smoking crack, and they'll go, it's okay. It's individual rights. Utah has great mental health facilities, but I don't know. And those are for in commercial insurance. They have lots and lots and lots. I've got 3 clients with family members in different facilities around Utah. They have really good mental health care if you have commercial insurance and you need the residential level of care and your loved one is willing to go. Because, oh yeah, did I mention residential care as well as PHP and IOP are all voluntary programs. So is SMRF, all of that. So is supported housing. Everything is voluntary. So you can't make somebody choose to not live in a shelter or live on the street. We'd love to, especially in Chicago. Although today was lovely. Today was 51. But yesterday, I had somebody walking the street and I was not happy because I was worried about their safety. So I don't know, Utah, Colorado, if you want to call me, if you want me to check into it for you, I'm happy to, but I only know commercial insurance for residential care in Utah and Colorado. I do know they both have commercial insurance, residential care. I don't know what their housing is. Housing, I'm pretty specific to Illinois. I do know that Medicaid is great in Minnesota and Wisconsin and pretty good in Illinois. I'm not going to complain. I'm not going to be mad at Illinois about that. We've got options. It could be better, but we're all working on it.
Someone asked if you have SSDI, do you automatically get Medicare coverage?
If you apply for it. So it depends what, usually the two do go hand in hand, but if you don't have it, you can reach out to Medicare and say, I'm on Social Security disability and I'm entitled to Medicare, and they will grant it to you. SSDI is disability. SSI, remember, Social Security insurance. You don't have to work. You don't have to do anything for it. But SSDI means either you're significantly disabled, that you got SSDI, you got it under the age of 21. You can get it without having a deceased or Social Security accepting parent. If you're under the age of 21, then you can get SSDI. So you need to have your significant event before the age of 21 to apply for SSDI. Now there's a Q&A. They're just making me dizzy here.
No worries, I'm handling it. You're all good.
I'll just do the talking. If you're over 21, if you have substantial, significant records proving that there were multiple hospitalizations prior to the age of 21, multiple levels of care taken advantage of, treatment with a psychiatrist, it's a pretty hefty ask. You can plead your case to get SSDI. Otherwise, you got to wait till a parent retires. For my son, I had to wait till his father retired. Not even married to him, but I had to wait till he was taking Social Security. And then I contacted them in his name and got it for my son. And I still needed to prove a whole lot of hospitalizations and requirements. I don't know what you're next.
No more questions as of now.
So everybody knows everything. Awesome. Well, it's an hour. What is Bonnie's contact information? Maureen says you don't know everything. Well, anybody can call me. You can go on my website. Courtney's going to put my slide up.
Give me just a second. Let me reload it. It's not.
Okay, so that's.
Come on.
Yeah, so that's my email and my phone number. My website is www.thefamilysupportservices.com. If you want to look and read how much I helped other families. www.thefamilysupportservices.com. I will tell you that if you call me, it may go to voicemail, or my voicemail may be full because there's a lot of spam going on right now. But you can always text me at that number. It's probably a better way of getting a hold of me. Text me or email me. Those are the best ways of reaching me right now. My pleasure. Jessica.
Wonderful.
Well,
thank you all for
thank you
joining
all
us
for spending
so
an
much.
hour.
Yeah. Thank you, Bonnie. This was really helpful.
It's my pleasure. There's more I could have said, but you know, give me a call and I'm happy to help whoever needs it whenever they need it. Okay. All right, guys.
Yeah. Thank you so much. The webinar will be posted on our website if you want to go back and look at it. There's also going to be a survey once you log out, if you don't mind taking that.
Yeah, say how wonderful I was.
Yeah. Thank you so much, everyone. Hope you have a good rest of your night.
Thank you, everybody, for spending time here. And I
Okay.
wish you health
Yes.
and peace.
Thank you. Thank you both.
Thank you. Good night,
Good night.
guys, for joining us. So this is just a webinar with Nami Cook County North Suburban and Bonnie Lane. My name's Courtney. I'm the Adult and Family Programs Manager with Nami Cook County North Suburban. NAMI is one of the nation's largest grassroots mental health organization. We offer no-cost support, education programs, and presentations. And again, our programs are free. So we're so glad you guys can join us here tonight. This year and each month, we've had mental health professionals join us to dig deep into a variety of topics to further educate us. So during this workshop, Bonnie will talk to us about different finding resources for your loved one, treatment, benefits, and housing through all levels of care. Like Bonnie mentioned, we'll have a Q&A at the end of her presentation, but you can also raise your hand or type in questions in the chat box. But thank you for being here, and Bonnie, go ahead.
Hi, welcome. Thank you for taking time out of this evening. Courtney didn't say it, but I have been on the NAMI CCNS board at least 3 separate occasions for a couple of years each time. And I currently still serve on the NAMI Housing Task Force for North and Northwest Suburban Cook County. I'm also on the NAMI Legislative Commission for the state of Illinois, where we try to get better laws enacted for people that struggle with mental health issues and their families. So today I'm going to talk about levels of care and how to find resources and housing, and what benefits are available to pay for them, or if commercial insurance is the best option. Mental illness runs a gamut from anxiety and depression, ADHD, all the way through severe psychotic illnesses, bipolar, which is a mood disorder, schizophrenia, which is a thought disorder, schizoaffective, which is a combination of bipolar and schizophrenia. And it starts as young as, the youngest case was a 4-year-old with schizophrenia, a 7-year-old diagnosed with bipolar. These are very unusual cases. And people typically become symptomatic between the ages of 18 and 26. What happens when our loved ones start to develop a mental health condition is we may notice it long before they do. Sometimes as we notice it, we can have a conversation with them about it. And sometimes we see it exacerbating and they're in denial, which is called anosognosia. Anosognosia is a lack of insight into one's own mental health condition. So how do we get them help? If they are willing, we can take them to a psychiatrist to have medication prescribed and managed. We can take them to a therapist to work on talk therapy, and we can put them into a variety of programs. If they have a serious episode, it may need hospitalization. And if they are unwilling to go to a hospital, there are ways to get our loved ones involuntarily hospitalized or into detox through a legal matter called a writ or a petition. I'm just going to talk on this very minimally, because I'm going to talk more about resources that are post-hospitalization. But a writ or a petition involves going to your county courthouse and filing paperwork that determines that your loved one is a danger to themselves or others, and a trained police officer will come to your home and take them to the hospital for a 3-day involuntary assessment. A psychiatrist in the hospital can then determine whether or not your loved one needs to be hospitalized longer. If they need stabilization, that will be the case. And sometimes after stabilization, they can come right back home and continue their lives, school, work, however they're living. But sometimes after hospitalization, coming home isn't an option. And then we have to look at treatment options. So the treatment options that are available are residential, intensive outpatient called IOP, and partial hospitalization, which is called PHP. It's actually PHP and then IOP. Residential in the state of Illinois does not exist on Medicaid. So primary mental health residential treatment requires commercial insurance done at that level. If you are able to do an PHP or an IOP, there are Medicaid-based programs. Most of them are hospital-based, like Chicago Behavioral Health, North Shore Endeavor, Lake Behavioral Health, Streamwood, Ascension, Alexian. So depending on where you live and what your Medicaid is, there are options for day treatment. PHP is usually 5 days a week for 5 hours or 6 hours a day. And then you step down to IOP, where it could be 5 days a week for 3 hours a day, or 4 days a week for 5 or 4 days a week. And it steps down until you're ready to do outpatient care. If your loved one is able to get into meaningful recovery with that level of treatment, they're medication compliant, and they're ready to live independently, we then have housing. So let's talk about what med compliance means. Med compliance means they take the medications prescribed as directed. It means you don't have to prompt them, threaten them. You are able to just say, you know, let's set up your meds once a week, and they take them on their own. Minimal prompting is still okay, as long as they don't go off it. The other consideration is if they are concurrently using recreational substances such as marijuana or alcohol or something stronger, then residential is probably the level of care that would be required for dual diagnosis treatment. Dual diagnosis treatment means a serious mental illness with addiction. There are other forms of dual diagnoses that don't involve